So the first question is, what does patient-centered care mean to you? Anybody want to start?
I think patient-centered care is more like actively involving your patient instead of just telling them like what you think needs to be done. Give them let them have input, let them kind of help make decisions about what they should be doing, and just plan everything out for them.
Yeah, because they know what works best for them. They already know what sort of their schedule looks like. So as long as you involve them in any of the decisions that need to be made and contributing with them, it would be best for their situation.
Yeah, and I feel like it just means like making them feel like they actually matter. Because I feel like so many times you go to the doctor and the doctor just walks in and says one word and then walks out, and that's like who you're paying and everything, and like actually caring about them and like talking to them and making them feel like what's wrong with them matters, like to you in that moment. So I feel like it's being like completely engaged to that person.
Yeah, don't make them feel like just a number. Like this is my 2:00, this is my 3:00. Like actually know about the person and get to know them.
Yeah, I think a lot of times the doctors just push you out. They don't really get to know you. I know you see all the time in the movies and shows that doctors in the like Grey's Anatomy will just try to be centered with their patients, know everything about them, but that doesn't actually happen in real life.
Right. But then when you actually have a doctor that does that, you like always remember that doctor.
Yeah.
And I feel like I always think of that doctor as being like the best doctor I've ever had. And like actually make me better. Because when I get bad doctors, I'm like, they didn't even help, so I'm not gonna get better. You know what I mean?
Yeah. They kind of give you like that negative vibe, like they're kind of just
they're busy.
Money. Yeah, they're busy. They're just here for their money, their paycheck, your money, I guess.
Yeah. Especially, I know sometimes in emergency situations that can't always happen. You can't always make them feel like they're the most important thing because you're trying to save them, even if they're conscious or whatever.
Yeah.
But even trying going the extra mile to make sure it's about them and not just about other things going on, it can better help the situation.
Yeah, but I feel like patients also like understand that in emergency situations. Like I'd rather the doctor just do what they have to do, or like athletic trainer or whoever it is. So hopefully they'd understand that. I feel like we talked about a lot of the things that the one article talked about, that like patient-centered care, like it has this, this, and this, and it said like it has communication, partnerships, and then also like health promotion and just like looking at your injury as a whole lifestyle thing instead of just like that specific injury. So
another thing with that too is in the article it was talking about how a lot of times we like to use our evidence-based practice, which generalizes populations of people, so we automatically put people, like we generalize them instead of looking at them in each specific case, like as a different individual. I think that's what patient-centered care is all about too.
They also in the article that that's not a bad thing because you need the evidence-based medicine or practice to get at some underlying roots and causes as a population to see what trends are going about, but and then it needs to go vice versa with the patient-centered care. You need to look at them and then look at this, like how it relates to them in different populations. So I think it all needs to culminate together into one big.
Yeah, I feel like you're both right. Like it's good to like know and like keep up on the evidence-based stuff and like learn about all these things, but then like at the same time, you know, when you see the same person walk in and you're like, oh, it's another, you know, whatever. A lot of times that like puts us in a rut too, because we're kind of like, oh, it's the same thing I've been doing. But if you like work really hard to focus on just that person and like their life and like them as a person, it makes it more fun for you and better for them. Like completely basing it on them.
I feel like it's harder for doctors, like in office and clinic too. I feel like we have a lot better opportunity to do the patient-centered care because we actually interact with our athletes and patients while we're doing stuff. We take the time to get to know them. We don't just get them in and out as fast as we can, like we're at a clinic.
Yeah, I definitely agree.
I think it also helps that besides just the clinical aspect of it, they know them outside of the clinic also, so that also helps. So if you have a smaller community, that also helps with how you get to know them, what is going on in their lives. So if you have doctors that are in the community as opposed to like hospitals that live other places, small towns can better, I think, are better equipped to realize that patient-centered care because they're right there. They know that people personally and all that stuff.
Yeah, actually, yesterday was my first like gen med rotation, and I was at Walnut Street, and literally Dr. Struble knew every person that walked in, and like they'd be like say, you know, oh, so and so's coming in, and all the nurses knew who that was and why they were coming in, and I thought that was pretty cool. That I don't know, I feel like I could have a serious problem and then go into the doctor, you know, 2 weeks later, and he's like needs reminded what's wrong or like about my history and everything. And she was seeing patients and knowing what happened 6 years ago when she first started here. And so like, I thought that was pretty cool. And that was something that they like really focused on in their clinic. But like obviously that's easy to do in North Manchester when you have such a small population.
So you think they did a good job of the patient-centered care
Oh, yeah.
at Walnut Street?
And I think if when you get to the hospitals, the doctors don't know you, even if you've been there before, they forget, and that sort of alienates the patients because they think that you should know and you should know everything, but you don't, and that just makes them feel like they're not important. And
Yeah.
that also plays into their psyche and how they perceive everything, and how they think everything will go, and how they believe will improve.
Yeah, and I feel like a lot of times people go to the doctor, like the athletic trainer, whoever, and they go because they like want to be taken care of. Like it's gotten to a point where sometimes just being like, I don't know, that like mothered feeling, like that's a good feeling, and like somebody actually cares about you. And I feel like if we just like push people to the side, or you know, have to be reminded, then that kind of like makes them feel like, no, I'm not getting what I wanted. But then at the same time, like it's kind of impossible to remember everything. So I feel like you have to like learn how to be able to ask that stuff, or you know, like look over charts or look over what you can, or get reminded before you like walk in with an athlete or a patient. But like you can always ask, but just ask in a way like you're like actually concerned, not like, oh yeah, what's wrong with you again?
Yeah, I think you have to consciously try to figure out those questions that can make it more personal and make you get to know them better. So that just takes some practice with your clinical works, and just try to get more personal with the patients to see what can work with them and how to connect with them better.
Yeah, I guess there is too. There's like that fine line too, where you have to still be like professional too, where you're not just having like casual conversation that anybody can hear. Like you might know stuff that they don't want anybody else to know, and you got to kind of keep that line of friend and professional while you're at the clinic.
Confidentiality.
Yeah.
Yeah,
And I like to in the article they were talking about how patient-centered care is it still patient-centered if you're doing all those things, but the patient's not actually getting any better? Are you still like centered on the patient even if you're doing all those things, but they're like medical problems not?
I think that's where
better.
the evidence-based medicine practice comes into play, because you need to have that patient-centered care, but also know the research behind what you're trying to do, and implement both, and try to find a happy medium between just doing the medicine part of it and being personal about it, and try to make it towards that.
Yeah, definitely. And I feel like though, if you're being personal, you're wanting that person to get better, so you're doing like everything in your power to like get them
And it
better.
makes you more
help them.
invested in in that patient when you get to know them better. You're more invested, which makes them feel better, and making them feel better will actually help them get better with either an injury or stuff like that.
Yeah, and because the best feeling is when somebody gets better, and then they're like, that was all because of
Yeah.
you, and then you're like, yes.
And then they can come back and actually be friends later and want to talk to you and stuff.
And they trust you for everything else.
Yeah, especially